Hello everyone, Lainey, Anna, Lewis, and I are doing our presentation on amyotrophic lateral sclerosis, or ALS. But what is ALS? In Greek, amyotrophic means no muscle nourishment. Lateral is the region of the spinal cord that is affected, and sclerosis is a scarring of the nerve tissue. Like you can see here on the right image, the nerve takes damage. You see the myelin sheath getting eaten away, compared to the image on the left. ALS is a neurodegenerative disorder, which means it'll affect the upper and lower motor neurons of the body. And this means you will have impaired muscle contraction, voluntary and involuntary muscle contraction. And that's anything from being able to walk to being able to breathe. It is also progressive, so it will only get worse. And there's no known treatment or way to reverse it, only ways to slow it down, but only slightly. And there are several symptoms, and they usually start light with something like twitching, cramping, or stiffening of the muscle, but it'll progress into things like impaired speech, the difficulty eating, impaired emotional displays. So you might end up crying or laughing unexpectedly or when you're not trying to. Also, weight loss. Some of this weight loss is due to muscle atrophy, wasting away because the muscle isn't being excited enough and activated enough, but a lot of it is due to damage taken by the hypothalamus. The hypothalamus is the regulator of energy metabolism in the body. So when that takes damage, people with ALS will see a decrease in appetite and an increase in metabolism. So the low energy intake of the decreased appetite and the high energy expenditure of the hypermetabolism leads to weight loss. And it can also be used to determine the severity of your ALS. So the more weight loss and the faster it occurs, the more severe your ALS probably is. You will ultimately experience fatal paralysis. You will lose the ability to move all muscles in your body, and that includes breathing, and your body will just waste away. Unfortunately, it's a nasty disease. Another symptom you might see is a metabolic dysfunction in the muscle. So you can actually notice this metabolic dysfunction prior to any of these other symptoms. So it can be a predictor of ALS, and it kind of challenges the previous idea of ALS and how it develops because it's a neurodegenerative disorder. So you think it comes from the brain and affects the muscles, but this is kind of challenging that and saying muscle metabolism might play a larger role in ALS than initially thought. Prevalence, who does this affect? One person was Stephen Hawking, a famous physicist, but it mostly affects middle-aged people. Men are 20% more likely than women to develop ALS. That's about 1 to 3 people per 100,000 in the US that are diagnosed every year. And the average survival duration is 2 to 5 years, but you can see people living past 10 years. It's just not common. And Caucasians, non-Hispanics, and veterans are more likely to develop ALS than other people. They're not sure why veterans experience ALS more than other people, but it's maybe due to chemical exposure or injury while in service. Of ALS patients, 90% of them are sporadic or have sporadic ALS, which means they don't know what causes it. They don't know what triggers it. It just occurs randomly. While the other 10% are familial, which means they're genetically predisposed to it. And there's certain genes we're going to be talking about later that play a role in familial ALS. The socioeconomic impact of this, it cost about 246 to 433 million dollars a year in the US in healthcare and patients. And that's not including all costs. That's just certain health costs. So it's likely going to cost more when you factor everything in that an ALS patient would have to go through while treating it, the disease. Looking at the history of it, it was originally identified ALS was originally identified by Jean-Martin Charcot in 1869. He was a French neurologist, but it gained a lot of popularity or awareness, I should say, when Lou Gehrig, a famous baseball player, was forced to retire in 1939 because of ALS, and that's why it is often referred to as Lou Gehrig's disease. And there's not much you could have done at the time. There still isn't much, but when we were first learning about ALS, they thought avoid exercise. They thought it was going to speed up the progression of ALS. But today, common treatment is PT, physical therapy. So it kind of contradicts earlier treatments because it might help prevent muscle from wasting away, strengthen your body, and help you prevent damages from falling. We can also use electromyography and nerve conduction to track the progression of ALS, see how active these muscles are, tracking electrical impulses in the nerves and the muscles. There's also medications you can use, but they don't really do too much. They only slow the rate of ALS. But there's other things like speech therapy and nutrition. Because you lose your appetite, you need more energy to go in. Unfortunately, sometimes you lose the ability to totally eat. So you're put on a feeding tube, which is unfortunate, but these are all things people try to do to slow the rate. But in the future, how are we going to try to understand this disease better? Well, they're looking at cellular defects. They're trying to understand really what goes on to trigger this. They think stem cells is a promising approach, so they can use stem cells to repair the damaged tissue from ALS. Genes, they're trying to understand what genes actually cause this, if they've identified all of them, and the epigenetics to see how this thing progresses over time. And there's certain biomarkers they're trying to identify or understand that will help track the progression of ALS a little better. But like I said earlier, metabolism is a predictor, which is a recent development. So metabolism might actually play a larger role in muscle metabolism than we originally thought.